Well, COVID-19 has been a huge test. And it's hard to know how well you prepared for the test before the test arrives.
When COVID first started coming about in January, it seemed very distant. We were starting to see some of the more tangible impact with some of the challenges with our personal protective equipment or PPE. We were starting to hear about mask shortages and how are we going to respond to that. And so the infection prevention team, which is part of our Quality and Safety Institute, which I had just newly come into as the Chief Quality Officer, really started to figure out how would we respond.
Dr. Busfar and I were the co-leaders of the Incident Command. We were there every day, through the weekends. I personally reviewed every policy, every communication. There was a team of us who were reviewing them, but we each double-checked them, reread them, pulled documents, scanning the literature, trying to ensure that we were providing the most updated information and the most rational recommendations.
Over the last 7 months, we've had lots of different types of challenges. I think everything from the clinical care and the guidelines that we're changing. We have a new disease, new ways to treat, learning how to answer questions so that people feel safe, people feel comfortable, has been a unique challenge to all of us.
The collective contributions of everyone has just been astounding. So many people have stepped forward and have done their utmost to make a difference. And many people have done things that I'm sure no one even knows. The way nurses and others comfort patients and families, the extra time people have taken to make phone calls, so many things like that are the real human-to-human moments, that the touch points that change people's lives. Those are the things that really make our management of the pandemic a success.
If a global pandemic has taught us anything in the current state that we're in, is that we have to be in healthcare ready to respond at a moment's notice, which has been true of healthcare always, I think, but at a different scale now with COVID.
There will always be challenges in the future, and I'm not sure exactly what form they'll take at this point. We don't know yet how well the vaccination research will bring forward an effective vaccine for COVID-19. It is safe to say that flu in some future year, whether it's this year or another year, will be severe. And so there are things that could intersect in a way that we are not yet envisioning that would draw on the tremendous resources of the organization, that would cause us to step forward yet again to meet the needs of our community.
I think sometimes when we talk about our ability to change guidelines and treatment protocols, it's hard to feel, it's hard to touch, it's hard to get your arms around it. But a building like the Sands-Constellation Center for Critical Care puts that in a more tangible way that I think the community can see, that our team members can see what's possible, what's doable, and really make it real. You just know walking in that I come into this building and I'll be taken care of no matter what my illness is, whether it's COVID related or not.
So what I can say is our team is prepared. Our team has really risen to the occasion, and they've made a big difference.